several of our organizations here in town that are devoted to prevention on HIV/AIDS and also caring for those who are affected by this disease have gotten together and are doing a candlelight vigil downtown, a small park named Gordon Young Park at the northwest corner of Main and Exchange Streets. I'm sorry, that's Main and Cedar Streets. It'll be at 7 p.m. and it'll run about an hour.
And when we look at the vigil, though, and I guess let's get to the location of it, and because I talked about awareness, you just didn't pick this park by chance. Talk about the location of the vigil and the significance there, Chris.
Thanks, Ray. The park is named Gordon Young, although very, very few people are aware of that. Gordon was a up-and-coming artist here in the Akron area back in the 1980s when this disease first occurred, and unfortunately he was infected with the virus, and back in those days people did not live very long once they got infected. So in the short time he had left, he really devoted himself to awareness, trying to make people aware that this was a killer disease that was out there. So once he passed, that little piece of land was named after him.
You know, when you go back, and it's hard to believe, Chris, it's been 30 years, 1981, when HIV really rose to prominence, and we were losing so many, unfortunately. But in Summit County, it has certainly hit home through the years. I know, over 1,000 residents have been diagnosed with the HIV infection. Maybe talk about the disease, because, and I've talked to some of folks pertaining to this issue about it, that it's not the sexy disease right now, but it is still front and center and unfortunately affecting many.
Exactly right, Ray. And one of the problems is that it's no longer a disease that kills people automatically. With our treatments today, with early diagnosis, which is critical, people who are infected need to be aware of that as soon as possible. The quicker that people can get into treatment, the better they'll respond, and it's become a pretty much manageable disease when it's handled properly. So we are seeing people living longer and productive lives, but again, the key is early diagnosis, being tested if there's any potential you might have been infected.
And when we talk about free HIV testing and early diagnosis, there's a number of locations that they can get this done, correct?
Definitely. There are several community-based organizations that do testing, free, confidential, and of course we do offer it at our Morley Health Center, downtown Akron on Broadway. Our website, you can get on there and find out, or people can feel free to give me a call at Summit County Public Health at 375-2453, which is my direct line.
Chris Partis is with us this morning from the Summit County Health Department. Chris, talk about the program tonight for the Candlelight Vigil. What will be included in it?
Ray, it's going to be very simple. We will have a couple speakers, just talk very briefly, remind people what it's all about. We will have actually battery-operated candles to prevent any possibility of people getting burned. And once we've had the speakers at 7, we'll do a walk around that block by the canal and back up to Main Street, and quietly, reverently, and we will have a closing prayer and allow people to share their stories and talk a bit, and that'll be it.
Begins at 7 o'clock tonight.
Yes,
education with HIV, I think we've gotten a lot better at this, but there is still some gray area where people might not understand HIV and AIDS, because there is a little bit of a difference here, Chris. And why don't you take this opportunity to put that education stamp on our conversation? Okay,
I'll try and make it brief and to the point. HIV is a virus. It's transmitted basically through sexual activity, or any time blood can go directly from one person to another, which may be via needles, very rarely in the case of blood splashing into an open wound, but really, in reality, sexual transmission in our area is the greatest risk. Once a person is infected, this virus goes to work in the body, attacking the immune system. It takes a period of years before it is able to really knock down the immune system. Once it's lowered their immune response, people then become diagnosed with AIDS, which means they become susceptible to a lot of diseases which may make them very sick or kill them.